The blood hadn't dried on Dr. Victor Hayes' gloves when he turned and pointed his finger at the quietest person in the room. "You're done," he said. "Pack your locker and get out of my hospital." Emily Carter didn't flinch. She stood beside the surgical tray with her hands still at her sides, and she looked at him the way someone looks at a storm they've already survived. Not afraid, just tired of the noise. Nobody in that operating room at Riverstone Medical Center in Port Ashford knew what she'd done in places they'd never been. Nobody knew what she'd held together with her hands in the dark, with bullets in the air and nothing but fieldcraft and nerve between a dying soldier and the ground. They were about to find out. Because 3 minutes from now, the worst trauma case of the year was going to come through those doors, and only one person in this building was going to know how to handle it. This is a work of complete fiction created for entertainment purposes only. All characters, locations, institutions, and events are entirely invented. If you're still watching, follow this channel, hit like, and drop a comment telling me what city you're watching from. I want to see how far this story travels. Now let's go back to the beginning. The morning shift at Riverstone Medical Center started the same way it always did, short-staffed, overlit, and louder than it needed to be. Emily Carter arrived at 5:47 a.m., 13 minutes before her shift began. She changed into her scrubs in a corner of the locker room, drank half a cup of bad coffee from the break room machine, and checked the board before anyone asked her to. She already knew which rooms needed attention, which supply carts hadn't been restocked from the night before, and which attending physician was going to make the morning difficult. That last part was never a mystery. It was always Hayes. Dr. Victor Hayes had been the chief trauma surgeon at Riverstone for 9 years. He was 51 years old, broad-shouldered in the way men get when they used to be athletic, and now just wear expensive clothes to compensate. And he had a habit of walking into a room as though the architecture had been designed specifically to frame his entrance. The nursing staff called him the Echo behind his back. Not because he was loud, though he was, but because everything he said seemed to bounce off the walls and come back twice as large. He did not like Emily Carter. He'd made that clear from her first week. She was too quiet, which he interpreted as insubordination. She didn't laugh at his jokes, which he interpreted as arrogance. She had a way of positioning herself near the surgical field that made the other attendings comfortable and made Hayes feel crowded, even when she was 3 feet away and doing nothing but holding instruments correctly. He couldn't name exactly what bothered him about her, so he named everything else instead. Carter. He said her name the way someone says a word they don't believe in. "You restocked Bay 4 yet?" "Yes," she said. She was already halfway down the hall. "I didn't ask if you were on your way. I asked if it was done." "It's done." He looked at her for a moment like he was waiting for her to elaborate or apologize or do something that would give him a foothold. She kept walking. That was the thing about Emily. She didn't give him footholds. She'd been at Riverstone for 14 months. Before that, the file in HR said she'd done a nursing degree at a state school in Virginia, a clinical fellowship somewhere in the Midwest, and then a 2-year gap that the HR coordinator had flagged once and never followed up on. Nobody had asked Emily about it directly. People generally didn't ask Emily Carter things directly because she had a quality that was hard to define, a kind of patience that made people feel like they'd already gotten the answer and were only now realizing it. What the file didn't say, and what nobody at Riverstone knew, was that the 2-year gap was actually 7 years, and the fellowship entry was a partial truth layered over something considerably more complicated. Emily Carter had served in the United States Army as a combat surgical specialist, attached to forward operating units in 3 separate overseas deployments. She'd operated in conditions that would make the Riverstone Trauma Bay look like a spa. She'd done chest compressions on a dirt floor while artillery shook the walls. She'd clamped vessels with instruments that weren't designed for the job because there was nothing else. She'd made decisions in seconds that attendings here would take 20 minutes to committee over and still get wrong. She'd held the rank of captain, and she'd been decorated twice, once for valor and once in the kind of quiet way that doesn't come with a ceremony. She didn't talk about it. She'd come back from her last deployment with something frayed in her that she didn't know how to explain to civilians, so she didn't try. She got the civilian credentials because the Army had given her the skills and the regulation required the paperwork. She applied for nursing positions because she wanted to keep working with patients, keep being useful, keep her hands doing something that mattered. And because the idea of sitting still anywhere for very long made her chest tight in a way she hadn't figured out how to fix yet. Riverstone had been the first place that called back. She hadn't told them about the army because they hadn't asked, and because it was her experience that when you mentioned combat service in a civilian hospital, one of two things happened. Either people treated you like a mascot, which was exhausting, or they treated you like a liability, which was worse. She'd learned to let her work speak for itself. That strategy worked everywhere except in rooms where the person in charge wasn't actually watching the work. Hayes wasn't watching the work. Hayes was watching his own reflection. By 7:30 that morning, she'd already quietly caught two things that would have become problems. The first was a medication dosage on a post-op patient in room 14 that the overnight resident had entered wrong. Not dramatically wrong, not immediately dangerous, but wrong in the way that compounds over 48 hours into something that explains itself badly to a family in a waiting room. She flagged it to the charge nurse without making a production of it. The second was more immediate. Hayes was preparing for a laparoscopic procedure on a 58-year-old man named Raymond Okafor, who'd come in 2 days earlier with acute abdominal pain. The pre-op workup was on the board, and Emily had read it the way she read everything. Not because she was assigned to, but because information in a surgical environment is either a tool or a gap, and gaps kill people. She found Hayes in the pre-op bay reviewing something on a tablet with the expression of a man who was technically looking at a thing without actually seeing it. "Dr. Hayes," she kept her voice level, "the CT from yesterday shows some collateral enhancement near the hepatic artery. Did you see the radiology note from Dr. Vasquez?" Hayes looked up from the tablet. "What?" Vasquez added a note at 11 p.m. He thought it might be worth a second look before, "I've reviewed the imaging." "Okay." A pause. "The note specifically flags the Carter." He set the tablet down with the careful deliberateness of a man performing patience. "I have performed over 800 laparoscopic procedures. I have been doing this since before you graduated high school. If I need a nurse to tell me how to read a CT scan, I will let you know." She looked at him for exactly 1 second. Understood. She walked out, found Vasquez's note on the system, printed it, and left it in Hayes' pre-op folder without saying another word about it. If he read it, fine. If he didn't, she'd document what she'd done and when. She'd learned a long time ago that you can't make someone see what they've decided not to look at. You can only make sure you're not the one standing in the gap when it collapses. The Okafor procedure went without incident. Hayes found the hepatic issue mid-procedure, managed it, and walked out of the OR 40 minutes later looking like he'd done something remarkable. He did not mention Vasquez's note. He did not mention Emily. He told the resident with him that good surgeons develop instinct, which is what separates real surgeons from people who just follow checklists. Emily was charting at the nurse's station when she heard him say it. She kept her eyes on the screen. Donna Reyes, the charge nurse who'd been at Riverstone for 15 years and had long since lost the capacity for surprise, set a coffee mug down next to Emily's keyboard. "You flagged it, didn't you?" "Vasquez flagged it," Emily said. "You flagged Vasquez's flag." Emily shrugged one shoulder. Donna looked at her for a moment. She was one of the few people at Riverstone who had figured out, through sheer accumulated observation, that Emily Carter was operating at a different level than the role she was filling. She hadn't said this out loud because Donna Reyes was not in the business of saying things out loud unless they needed to be said, but she'd started quietly making sure Emily was assigned to the bays where the complicated cases landed. "Hayes is going to do something stupid eventually," Donna said. "He always does." "Probably," Emily said. "When he does, I want you to remember that I said that today." Emily looked at her. "Why?" "Because you're going to feel like you should have seen it coming. I want you to know that some things you can see coming all day long, and it doesn't matter because you can't stop them. You can only be ready when they land." Emily didn't say anything. She went back to charting. She thought about that conversation later, after everything happened, and she thought Donna was exactly right about all of it. The call came at 11:47 a.m., multi-vehicle collision on the interstate. 17 miles east of Port Ashford, 2 semi-trucks and 4 passenger vehicles, unknown number of casualties, EMS en route with multiple criticals. The trauma bay began reorganizing itself with the particular controlled chaos of a team that has done this before and knows that knowing what you're doing is the only thing standing between competent and catastrophic. Hayes materialized in the bay with the energy of a man who had been waiting for exactly this. Mass casualty events were where he performed, and he performed in the theatrical sense. He liked the movement, the urgency, the way staff organized around him, the feeling of being the fixed point in a spinning room. He was not a bad trauma surgeon when he was paying attention. That was the complicated truth about him. He had genuine skill. He also had an ego that intermittently eclipsed that skill, and in a trauma bay, that was a dangerous combination. Emily took her position at the secondary tray, checked the instrument layout, verified the blood product availability, and waited. The first ambulance arrived at 12:03. They came in fast after that. A woman in her 40s with a fractured pelvis, a teenager with a pneumothorax, and an elderly man with a head laceration that looked catastrophic and turned out to be mostly superficial. 2 walking wounded who shouldn't have been in the trauma bay at all but ended up there because the intake had been overwhelmed. And then the 4th gurney came in, and something shifted in Emily's attention. He was young, early 20s, dark-haired, wearing a light blue t-shirt that was soaked almost entirely through with blood. His blood pressure was dropping. She could see it in the way he was lying, in the color of his skin, in the quality of his breathing. The EMT rattling off vitals said he'd been the driver of the lead passenger vehicle, that he'd been conscious at the scene and had deteriorated fast in transit. Abdominal trauma, possible internal bleed, the EMT said. BP's been falling since we picked him up. GCS was 14 at the scene, 12 now. Hayes was already moving to the gurney. Abdominal CT, 2 large-bore IVs, blood bank on standby. He pressed the abdomen. The young man winced and made a sound that barely qualified as a sound. Possible splenic involvement. Let's get imaging. Emily was positioned at the equipment tray 3 feet away, and she was watching the young man's chest. The way he was breathing wasn't right. It was too fast, too shallow, and it had a quality to it that she'd seen before. Not in a hospital, but in a field, in the bad kind of light, with the sound of helicopters overhead and someone telling her they were running out of time. The abdomen was bleeding. She was fairly sure of that, but the abdomen wasn't what was going to kill him in the next 4 minutes. "Dr. Hayes," she said. She kept her voice quiet and clean. "I think we should consider aortic involvement." He didn't look up from the patient. "We're managing the abdomen. His BP drop is too fast for splenic. The trajectory from impact suggests Carter." He looked up now. The look was the kind that's supposed to end conversations. "I have the imaging ordered. We will follow the imaging. There may not be time to wait for imaging." The silence in the bay was the kind that has a weight to it. "What did you just say to me?" She met his eyes. "I said there may not be time to wait. His pressure's at 82 and falling. If this is an aortic rupture, stay in your lane," Hayes said. The words were low and deliberate and had a finality to them that the other staff recognized. She was being put down in front of everyone, and everyone knew it, and the correct institutional response was to absorb that and go quiet. She went quiet, but she didn't move away from the gurney. 40 seconds later, the monitor alarm went off. The young man's heart had stopped. Hayes looked at the flatline, and for one terrible moment, not long, maybe 2 seconds, maybe 3, he didn't move. Not the calculated stillness of someone choosing their action, but the frozen stillness of someone whose training had outrun their nerve. He'd done this 1,000 times in less extreme circumstances, and his body had learned the steps. But the steps required the starting signal, and the starting signal wasn't coming. Emily was already moving. She stepped to the gurney, called out, "Chest compressions," and when nobody moved fast enough, she started them herself. Not the careful, textbook-spaced compressions of a hospital simulation, but the hard, committed, get-it-done rhythm of someone who has restarted a heart in a place where the equipment was optional. She called for the thoracotomy tray. The resident across the table looked at Hayes, who still hadn't moved, and then looked at Emily and then started pulling instruments. "I need a thoracotomy blade and a rib spreader," Emily said. "Now." "She doesn't have authority to..." Someone started. "Now," Emily said, and the word left no room for the sentence to finish. She opened his chest with the efficiency of someone doing a thing they have done before, in worse conditions with less equipment. She found the aorta. It was torn, partially, a rupture that hadn't completed yet, which was the only reason he'd made it this far. She got a clamp on it with her left hand, used 2 fingers of her right hand to tamponade the secondary bleed, and said, "Someone call CT Vascular. Tell them we're coming up in 3 minutes, and I need the team scrubbed." The room was completely silent except for the monitors. Hayes took a breath, then another. He came back to himself in fragments. She could see it in his face from 3 feet away. What came back first wasn't professionalism, it was damage control, which was its own kind of professionalism, she supposed, just the wrong kind. "Get her hands off my patient," he said. Nobody moved. "I said, her hands are the only reason your patient is still alive," Donna Reyes said from the doorway. She said it without heat, the way you state a measurement. Then she looked at Emily. "What do you need?" Emily told her. Donna made the calls. The vascular team was ready upstairs. Emily maintained the clamp through the transport, which she'd done before with fewer people helping, and when they got him into the vascular OR and the attending took over from her position, she stepped back and stood still and breathed through her nose for a count of 5. He was going to live. The tear was manageable. The clamp had held. She walked back down to the trauma bay, and Hayes was standing in the middle of the room. He was looking at her the way people look at something they can't file anywhere. "I want her badge," he said. He said it to the room, not to her, which was deliberate. "I want her badge and I want her gone by the end of the hour." That was an unauthorized procedure performed by an unqualified staff member on my patient, and I will not— "It wasn't unauthorized," Emily said. "He was in cardiac arrest. The protocol—" "Don't," Hayes said. His voice had dropped into something quieter and far more dangerous than shouting. "Don't stand there and quote protocol at me. You shoved me aside in front of my entire team and cracked open a patient's chest because you decided your read was better than mine. That's not protocol. That's insubordination. That's assault on a patient, legally speaking, and I will have the board review every action you took in this room today." Emily didn't answer. "Your career in this hospital is over," Hayes said. "Do you understand me? Over." She looked at him for a long moment. Then she said, "The patient is alive." She walked out of the trauma bay, down the hall, and into the locker room. She sat on the bench for a moment. Her hands were completely steady. She wasn't shaking. She hadn't shaken after procedures since her second deployment, when she'd finally learned that the shaking was the body's way of catching up with what the mind had already processed, and that the trick was to just let the mind process it faster. She breathed. She looked at her hands. Then she started taking her personal items out of the locker. Down the hall, at the ambulance bay entrance, Donna Reyes was watching 3 black vehicles turn into the hospital drive. She didn't recognize the plates, but she recognized the profile. The shape of military vehicles was something you either knew or you didn't, and Donna had a brother who'd done 20 years in the Navy, so she knew. She watched them park. She watched the figures get out. She watched one of them, tall in dress uniform, pause at the entrance and speak to the security guard. She heard, at a distance, the question. She stood very still. Then she turned and walked quickly in the direction of the locker room, because Emily Carter was about to leave the building and there was something Donna needed to tell her before she did. Donna pushed open the locker room door without knocking. Emily had her jacket in one hand and her bag on the floor, half packed. She looked up when Donna came in, and something in Donna's expression made her stop moving. "There are military vehicles in the parking lot," Donna said. Emily didn't react the way Donna expected. She didn't straighten, didn't look toward the door, didn't ask the obvious follow-up question. She just looked at Donna with that measured stillness that Donna had never quite gotten used to, even after 14 months. "How many?" Emily asked. 3, black, and someone in dress uniform asking for you at the entrance. Emily set the jacket down on the bench. "Asking for me by name?" "I didn't hear the name from where I was standing, but security looked confused and then pointed toward the building, so—" Donna crossed her arms. "Emily, what's going on?" "I don't know yet." "That's not an answer." "No," Emily said. "It's not." She picked the jacket back up, but she didn't put it on. She held it in both hands for a moment like she was deciding something. Then she set it down again. Who's at the front desk right now? Marcus. Is Hayes still in the trauma bay? Hayes is currently on the phone with the chief of medicine, which is going to be a deeply unpleasant conversation for everyone involved, including the chief. Donna paused. You should know that 3 people in that room already told me they're prepared to give statements about what happened, what you did, how you did it. I didn't ask them to do that. Nobody asked them. That's why it matters. Donna looked at her steadily. The patient is invascular. They're saying he's going to make it. Emily absorbed that without visible expression, which was its own kind of expression. Okay, she said. Okay meaning what exactly? Okay meaning he's going to make it. She exhaled slowly through her nose. That's what matters. Donna wanted to say something to that. She had several things to say to that. But the door opened before she could choose one, and Marcus from the front desk leaned in with the look of someone who had been sent on an errand he didn't fully understand. Emily Carter? He was looking between the two of them. Yes, Emily said. There's some people at the front, military. They're asking for you specifically. They have your full name, and one of them has stars on his uniform, and I genuinely don't know how many stars means what, but it seems like a lot. Donna watched Emily's face do something almost imperceptible, not quite surprise, more like the expression of someone who just heard a word they hadn't heard spoken aloud in a long time. Tell them I'll be out in a minute, Emily said. Marcus disappeared. Donna stayed. You're not going to tell me anything, are you? Donna asked. Emily almost smiled. It was the most expression Donna had seen from her all morning, which was saying something given the morning they'd had. Thank you, Emily said. For what you said in there, you didn't have to do that. I've been watching you cover for that man for 14 months, Donna said. Watching you catch things and not say anything and just quietly fix them and walk away. Today you didn't have a choice except to be visible. And he used that to try to end your career, and so yes, I said what I said. She paused. I'd say it again. Emily picked up her bag. I know you would. She walked out. The hallway felt longer than usual, which was a function of awareness, not architecture. She noticed things she didn't normally clock. The squeak of a supply cart near the nursing station, the overhead announcement about a visiting schedule change, a maintenance worker on a ladder replacing a ceiling tile near the east stairwell. She noticed them because her brain was in the gear it shifted into when she was moving towards something uncertain, cataloging her environment automatically, an old habit she'd tried to unlearn and hadn't fully managed. She turned the corner toward the main lobby and stopped. There were 4 of them, 3 in standard military dress, positioned with the particular relaxed alertness of people who are always watching exits. The 4th was in full army dress uniform, and Donna had been right. The insignia were significant. He was in his early 60s, lean without being thin, with a face that had clearly once been handsome and was now something better than that. Experienced, precise, patient. He was standing with his hands clasped behind his back, and he was looking at the elevator bank when Emily came around the corner, and then he turned. She knew him. Not immediately. Not in the instant recognition way of someone you've seen recently. It was the slower recognition of someone you last saw in a context so removed from the present that your brain has to do translation work first. Desert light. 70-degree heat at 4 in the morning. A forward operating base outside the wire. 3 years ago. Maybe 4. A general who had walked through a field trauma station and stopped at every cot and looked at every face. Brigadier General Marcus Webb. Except the insignia said he wasn't a brigadier anymore. She came to a stop 6 feet from him, and her body made a decision before her mind finished catching up. She stood at attention. It wasn't theatrical, it was just what you did. The posture was as natural as breathing after 7 years, and the fact that she was in scrubs instead of a uniform didn't change the muscle memory underneath. General Webb looked at her for a long moment. Something moved through his expression that she couldn't read. Then he said, very quietly, "At ease, Captain." The word captain landed in the lobby like it had weight. One of the military police behind him straightened slightly. The other 2 exchanged a look. "Sir," Emily said. "You're a hard woman to find quickly," Webb said. "Your file shows a civilian address in Port Ashford, nursing staff at this hospital. I want you to know it took us 37 minutes to get here from the base, which is a record for this kind of mobilization. and my driver is inordinately proud of himself about it." Emily didn't say anything. She was waiting. Webb's expression changed. The careful formality shifted into something that was not professional at all. "My son was brought in here," he said, "an hour ago." And there it was. Emily held very still. The young man in the blue t-shirt, dark-haired, early 20s. She hadn't looked at his intake information closely. There hadn't been time, and during the procedure itself you don't see the file. You see the body, the problem, the solution. But she thought now about the shape of his face, and she could see, looking at Webb, how that math worked. "He was in the trauma bay," she said. "He's in vascular surgery now." "I know," Webb said. "I've been briefed on the broad strokes. What I want to hear is the rest of it." His voice was controlled in the way that voices are controlled when the alternative is something the speaker is not willing to do in a public lobby. "I want to hear from the person who was actually in that room." "I can tell you what I did," Emily said. "I can't tell you what anyone else was doing. That's all I'm asking." She told him. Not all of it. She gave him the clinical version, compact and precise, the mechanism of injury she'd identified, the timeline of deterioration, the decision point, the procedure, the transfer to vascular. She kept her voice flat and factual because that was the version that was actually useful, and because Webb was the kind of man who didn't need emotion translated for him. He would understand the information, and he would feel whatever he was going to feel about it on his own time. When she finished, he was quiet for a moment. "The surgeon who was managing the case," Webb said, "I can't speak to what anyone else was doing," Emily said again. Webb looked at her with something that might have been the beginning of a tired smile. "You always were careful, Captain." "I'm not a captain anymore, sir." "You will always be a captain," Webb said. "That's not a rank. That's a quality." Across the lobby, the elevator opened and Dr. Victor Hayes stepped out. He was still in surgical scrubs, still wearing the expression of a man building a legal argument in real time. He had his phone in his hand and his jaw set, and he was already moving toward the main desk with the momentum of someone who had decided what was going to happen next. He saw Emily first, which made him walk faster, and then he registered the uniforms and slowed slightly, and then he registered the stars and stopped. "General," he said. He shifted his posture immediately, the particular physical recalibration of a man who has identified someone important. "I'm Dr. Victor Hayes, Chief Trauma Surgeon. I want to assure you that your son is receiving—" "I'm aware of my son's condition," Webb said. He didn't look at Hayes when he said it. He was still looking at Emily. Hayes noticed this. He recalibrated again. "If you have questions about the surgical team's decisions, I'm happy to walk you through—" "Were you the attending in the trauma bay when my son arrested?" A pause. "I was the lead physician, yes." "And you performed the emergency thoracotomy that stopped the hemorrhage?" The lobby was quiet enough that the question was audible to the front desk staff, to the two visitors sitting near the window, to the military police who had been standing with the practiced stillness of people paid to notice things. Hayes looked at Emily for just a fraction of a second. It was a fast look, the kind that's supposed to be invisible and isn't. "The response to the cardiac event was a team effort," he said. "In mass casualty situations, the entire unit—" "I'm asking about the thoracotomy," Webb said. "Specifically, who opened my son's chest and clamped the aorta?" Another pause. Longer this time. "That procedure was performed under my supervision." Emily looked at the floor. She looked at it not because she was ashamed or hiding, but because she was deciding whether to say anything, and while she was deciding, the calculation changed, because the elevator opened again and Donna Reyes walked out. And behind Donna were two members of the trauma bay staff, Preeta Anand, a third-year resident, and James Kowalski, one of the OR nurses who'd been on the secondary tray. And both of them had the look of people who had made a decision. Preeta spoke first. She was 27, quiet in meetings, precise in the operating field, and right now her voice was steadier than Hayes had probably anticipated. "General Webb," she said. She addressed him directly, which took nerve and she knew it. "My name is Dr. Preeta Anand. I was in the trauma bay during the entire event. I want to give you an accurate account of what happened." Webb turned to look at her. "Dr. Hayes was the assigned attending," Preeta said. When the patient arrested, there was a delay in response. Emily Carter, the nurse standing here, she initiated compressions immediately, called for the thoracotomy tray, and performed the procedure. She maintained control of the aortic bleed through transport to vascular. She paused. Dr. Hayes did not perform or assist with the thoracotomy. He was present in the room. The lobby absorbed that. Hayes's expression went through several things very quickly. The first was something like calculation. How do I contain this? The second was something darker, aimed at Prita, aimed at Emily, aimed at the shape of the morning going wrong. The third settled into a kind of rigid composure that was worse than anger because it was controlled. Dr. Anand, he said, I would strongly advise you to consider the implications of Dr. Hayes. The voice came from behind him. He turned. Dr. Sylvia Park, chief of medicine, was standing at the edge of the lobby. She was 55, small, with gray-streaked hair and reading glasses pushed up on her head, and she had the very specific expression of a woman who had been on the phone for the last 40 minutes and had arrived at a conclusion she wished she hadn't. I need you in my office, she said. Now. I'm in the middle of... Now, she said. Same word Emily had used in the trauma bay, same quality of leaving no room. Hayes looked at Emily one more time. Whatever he'd intended that look to communicate, it didn't land the way he planned. She met it without expression, without challenge, without anything he could use. He turned and followed Park toward the administrative wing. The lobby breathed again. Webb was watching Emily. You weren't going to say anything, he said. It wasn't my place to correct the account, Emily said. Other people were there. That's a very careful answer. Yes, sir. He looked at her steadily. My son is 23 years old, he said. The formality had dropped out of his voice entirely. What was underneath it was just a father, and that was harder to look at than the general, so she focused on a point past his shoulder. He's 23 and he drives too fast, and he doesn't call often enough, and There were 2 calls I was dreading today, and one of them was being told I got here too late. He stopped, collected himself with the discipline of a man who has had a lot of practice. You understand what I'm saying? Yes, sir, she said. I understand. Thank you, Captain Carter. She started to correct him again. She wasn't a captain, she was a nurse. She was a civilian. She was a person with a half-packed locker and a termination she hadn't formally received yet. And then she stopped. Because he wasn't wrong, exactly. The rank was gone. The thing underneath the rank was not. He's going to need some time, she said instead. The repair is significant, but the vascular team here is good. He was young, and he was strong, and we got there in time. A beat. That's the part that matters. Webb nodded once. One of the military police, a staff sergeant, she'd assessed the rank without meaning to, stepped forward and said quietly, Sir, Dr. Harmon from Vascular is on the line. Webb excused himself and moved a few steps away to take the call, and Emily was left standing in the middle of the lobby with Donna and Prita and Kowalski in a loose constellation around her, none of them quite sure what came next. You should know, Donna said quietly, that Hayes submitted the termination paperwork about 20 minutes ago. It's in the system. Emily absorbed this. He was on the phone with Park while he submitted it, Donna continued, which I only know because Marcus at the desk heard the conversation and Marcus has no filter whatsoever. What was he saying to Park? That you'd performed an unauthorized invasive procedure without attending authorization, that you'd physically displaced the attending physician, and that you'd created a liability exposure for the hospital. Prita made a sound that wasn't quite a word. He's not entirely wrong about the procedure, Emily said. Technically, without attending sign-off, the patient was dead, Kowalski said. He had a flat, matter-of-fact delivery, Kowalski. The voice of a man who'd been in operating rooms long enough to find euphemism wasteful. Technically, without you, the patient was dead. That's the other technical fact. Emily didn't answer that. There wasn't anything to add to it. Across the lobby, Webb ended his call. He stood for a moment with his phone in his hand, and from where Emily stood, she could see his shoulders drop slightly. The specific release of breath that happens when someone has been told the thing they needed to hear. Then he turned around. He's out of surgery, Webb said. Repair was successful. They're moving him to ICU. Preeta exhaled audibly. Kowalski pressed his lips together in what was probably relief. Emily nodded. Webb walked back toward her. He stopped closer this time, close enough that she could see the lines in his face clearly. The particular weathering of a man who had spent decades making decisions that cost things. He looked at her with an expression she recognized from a very specific type of moment. The moment after something bad happened, and the bad thing was over and you were taking stock of who was still standing. "I'm going to need a few minutes with Dr. Park," he said, "and I'm going to need you to not leave this building before that happens." Emily looked at him. "Sir, I should let you know that I've been terminated. Captain Carter." He said it with a gentleness that was somehow more authoritative than the formal version. "I'm not asking you to do anything except not walk out that door for the next 20 minutes. Can you do that?" She thought about the bag in the locker room, the jacket on the bench, the half-drunk cup of bad coffee from this morning that felt like it had happened 3 days ago. "Yes," she said. She found a chair near the window that faced the parking lot. She sat. She watched the military vehicles in the drive and the ordinary Port Ashford afternoon moving past them outside the glass. A delivery driver, 2 women with a stroller, a kid on a bicycle who almost hit a parking meter and didn't. And she was quiet. Donna sat down in the chair next to her without asking. She didn't say anything. She just sat there, which was exactly the right thing, and Emily was grateful for it in the specific, wordless way she was grateful for most things. 15 minutes passed, then 20. She heard the elevator before she saw anyone come out of it. Then the doors opened and Dr. Park stepped into the lobby, and behind her came Hayes, and his face had the particular ashen quality of someone who has walked into a room expecting to be given something and has been handed back something entirely different instead. And behind Hayes came General Webb with 2 of his staff, and Webb was not looking at Hayes at all. He was looking at Emily. He crossed the lobby toward her, and Hayes followed because he didn't know what else to do, and the lobby staff were watching with the transparent interest of people who had clocked that something significant was happening and were going to be describing it at dinner for the next 2 weeks. Webb stopped in front of Emily's chair. "Stand up," he said, and his voice had changed. It had the formal, projected quality of an official moment, not a private conversation. She stood. He reached into his breast pocket and produced something. It was small, and it caught the afternoon light from the window. She looked at it for a moment without speaking. It was a coin. Military. She recognized the insignia on it. A particular unit, a particular campaign, the kind of coin that gets handed to very specific people for very specific reasons. She'd received one before. She knew what they meant. "You saved my son's life," Webb said. He held it out. She took it. Behind Webb, Hayes was standing very still, and he was looking at the coin, and his face was doing something complicated that had to do with the distance between what he'd assumed and what was actually true. The lobby was quiet. Outside the window, the Port Ashford afternoon went on being ordinary, unaware that inside the building, a woman who had been fired 40 minutes ago was being handed a military coin by a 4-star general, while the man who had fired her stood 6 feet away and started to understand, for the first time, the size of the mistake he'd made. Hayes was still looking at the coin when Webb turned to face him. It wasn't a dramatic turn. It wasn't slow or cinematic. It was just a man redirecting his attention from one thing to another, the way you redirect attention when you've finished with something important and are now ready to deal with something considerably less so. That quality, the casualness of it, was somehow worse than anger would have been. Anger could be argued with. This couldn't. "Dr. Hayes," Webb said. "General?" Hayes had recovered enough to produce a professional expression. Not warmth, not guilt, just the practiced neutrality of a man who has spent a career navigating administrators and boards and the particular politics of large institutions. "I want to say again how relieved we all are about your son's outcome. The team here at Riverstone, you told me you performed the thoracotomy." The sentence landed flat and complete, with no space around it. Hayes opened his mouth, closed it. "I said the response was a team. You said it was performed under your supervision." Webb's voice hadn't changed in volume or temperature. It was the steadiness of it that was unnerving. "I've now spoken with Dr. Park. with the resident who was in the room, with the OR nurse, and with the EMT who brought my son in. I have 4 separate accounts. None of them match yours. In high-pressure situations, memory, Dr. Hayes. Webb took 1 step closer, and it wasn't a large step, but Hayes moved back slightly anyway, which was involuntary and visible. I'm going to be very precise with you because I think precision is what this moment requires. My son was in cardiac arrest. A nurse, this nurse, stepped into a gap that you left and performed a battlefield-grade emergency thoracotomy that kept him alive long enough to get to a surgical team that could fix him. You then terminated her employment and told me, when I asked directly who had saved my son's life, that you had. He paused. Is there any version of that account that you want to correct? The lobby had gone entirely silent. The front desk staff were not pretending to do anything else. The 2 visitors near the window had not moved since Webb started speaking. Marcus had set down his pen. Hayes looked at Park. Park looked back at him with the expression of a woman who had already made her decisions and was watching someone else make theirs. I may have been unclear, Hayes said. In the moment. Were you unclear, Webb said, or were you dishonest? The words sat in the lobby air. Hayes said nothing. Because those are meaningfully different things, Webb continued, and the answer affects what happens next. Park spoke then, quietly, from beside Webb. Victor, I'd recommend you stop talking. Hayes looked at her. Something in his face had changed. The professional composure was still there, but it had gone thin, like a layer of ice you can see through. Underneath it was something that might have been the beginning of real fear, or might have been pride reconfiguring itself into damage control. With Hayes, it was always hard to tell which came first. He said nothing else. Park turned to Emily. I need to speak with you in my office. Both of you, actually. General, if you have a few minutes. I have as many minutes as necessary, Webb said. They moved toward the administrative wing, and the lobby returned slowly to ordinary noise, and Emily followed Park and Webb through the door at the end of the hall, with the coin still in her left hand because she hadn't found a pocket to put it in yet. Park's office was on the 3rd floor, corner room, with a window that looked over the hospital's east parking lot and a stretch of Port Ashford that was mostly residential. Houses with small yards, a school in the middle distance, the ordinary architecture of a city going about its day. The office itself was organized in the way of someone who processes large amounts of information and has learned that physical clutter translates into mental clutter. Bookshelves with actual books, a desk with actual files, 2 chairs across from it, and a low table with water glasses that someone had set out recently, probably Marcus calling ahead. Park sat behind the desk. Webb took one of the chairs. Emily stood until Webb gestured toward the other chair with a slight tilt of his head, and she sat. I'll be direct, Park said. She had her hands flat on the desk, and she was looking at Emily. The termination paperwork Hayes submitted is currently under review, given the circumstances being a significant discrepancy between the attending's account and 4 independent witness statements. I'm not in a position to act on it until the review is complete. What does the review involve? Emily asked. Statements from everyone present. Incident report filed by the charge nurse, Donna Reyes, which she filed approximately 40 minutes ago, voluntarily, with significant detail. Park's expression shifted slightly. Also a review of Dr. Hayes' conduct record, which I've been meaning to do for reasons unrelated to today, and which today has made considerably more pressing. Emily absorbed this without comment. I also need to tell you, Park continued, that performing an unauthorized thoracotomy, regardless of outcome, is a serious procedural violation. I'm not dismissing that. The outcome was excellent. The intent was clearly to save a patient's life. Those things don't automatically resolve the procedural question. I understand, Emily said. What I'm saying is that this isn't simple, and I'm not going to pretend it is in order to make anyone in this room feel better. Park looked at Webb. That includes any considerations arising from the patient's identity or family connections. Webb nodded. I'm not asking for considerations. I'm asking for accuracy. Then I'll also tell you accurately, Park said, that the emergency exception clause in this hospital's protocol does cover autonomous intervention in the case of cardiac arrest when the assigned attending is not actively managing the event. which means the thoracotomy, under those specific circumstances, was likely defensible within our own written policy. She paused. The paperwork will need to reflect that. But the paperwork can reflect that. Emily looked at her. You're saying the termination doesn't stand. I'm saying the termination was submitted by a physician who in the same hour misrepresented his own actions to the patient's family, which is a materially different category of problem. Park picked up a pen, set it back down. Victor Hayes is on administrative leave pending review. That review is going to look at today, and it's also going to look at the last 9 years, and I won't tell you what it's going to find because I don't know yet. What I can tell you is that nobody is being terminated today except the person who was already on his way to earning it. Webb was watching Park with the expression of someone revising an estimate upward. There's something else, Emily said. Both Park and Webb looked at her. She was quiet for a moment, the way she was quiet when she was choosing words rather than just producing them. There are other things. Cases. Over the past 14 months, there have been instances where procedural decisions were made that I flagged and that weren't addressed. A medication dosage this morning. A case 3 months ago where imaging indicated a possible secondary pathology that wasn't pursued. I documented what I could. I flagged things through the charge nurse when I could. She looked at Park. I want those to be part of whatever review you're doing. Park was very still. How many instances are we talking about? I'd need to go through my notes. More than 10, fewer than 20. A pause. I kept a log. The room was quiet for a moment. You kept a log, Park repeated. Yes. Of flagged concerns going back how far? 11 months? Park exhaled slowly through her nose. It was a controlled sound, the sound of someone absorbing information that is both useful and expensive. I'm going to need that log. I can have it to you today. Webb had not said anything during this exchange. He was sitting with his forearms on his thighs, watching Emily with an expression she couldn't categorize until she realized she'd seen it before. In the field, in the moments after a situation resolved itself, and someone was doing the reckoning. He looked like a man accounting for what things had cost, and what they hadn't, and what the difference meant. Captain Carter, he said. I'm not a captain anymore, she said. Force of habit. The word kept coming out of her. Former Captain Carter, he said, with a patience that suggested he'd concede the point this once. Why didn't you tell anyone here about your background? It didn't come up. That's not what I asked. She looked at the window, the school in the middle distance, an ordinary October afternoon. When you come out of deployment and into a civilian setting, you figure out pretty fast that your background reads differently depending on who's reading it. Some people think it means you're overqualified for what you're doing. Some people think it means you have problems adjusting. Some people just don't know what to do with it. She brought her eyes back to him. It was easier to just do the job. Let the work be what people saw. And when someone like Hayes made that harder, I documented it and kept my head down. A beat. Which is not what my drill sergeant would have recommended, but it's what the environment called for. The corner of Webb's mouth moved, not quite a smile. Master Sergeant DeLuca? She looked at him. How did you... I read your file 4 years ago when you were being considered for a commendation. DeLuca wrote the recommendation letter. He said you were the most deliberately invisible, effective person he'd ever served with, and he meant it as the highest possible compliment. Emily was quiet. He also said, Webb continued, that the worst thing about people like you is that you let institutions fail you because you're too disciplined to make noise. He paused. I thought about that letter today, when I was getting the picture of what happened in that trauma bay. Park had been listening to this exchange with the careful attention of someone filing things for later. Now she said, I want to be clear about something. Whatever Emily's background is, whatever she's done elsewhere, the reason the termination doesn't stand isn't her military record. It's the fact that she acted correctly within this hospital's protocols, and a patient is alive because of it. I want that on record. Agreed, Webb said. I also want it on record, Park continued, looking at Emily, that I'm sorry. For the environment that made 11 months of documented concerns necessary before anyone looked at them. She said it simply, without performance. That's on me. Not entirely on Hayes. Emily looked at her for a moment. All right, she said. It wasn't forgiveness exactly. It wasn't absolution. It was just acknowledgement received, which was its own thing and probably more honest. Park's phone rang. She looked at it, then at them. Excuse me for a moment. She stepped out. The office was quiet. Webb leaned back slightly in his chair and looked at Emily with the expression of a man who has more to say and is deciding how much of it belongs in this particular room. I'm going to ask you something, he said, and I want you to know you can tell me to mind my own business. All right. Are you okay? She looked at him. Yes? I mean the larger question, coming back. The work you're doing here, being treated the way you've been treated. He paused. Are you okay? It was a different question the second time, without the period, genuinely open-ended. She thought about it, not the reflex answer, but the actual one. She thought about the last 14 months, the early shifts, the bad coffee, the careful documentation of things she'd seen and wasn't sure anyone would ever look at. She thought about the way she'd learned to move through the wards without taking up space, without making people uncomfortable, without causing the kind of friction that turns into a personnel issue. She thought about how good she was at being invisible and how much that skill had cost her in a different context and how strange it was to have brought it here. Some days, she said. Webb nodded once, like he'd expected that answer and respected it. What are you going to do next? He asked. I don't know yet. I was in the middle of packing my locker when Donna found me. Don't pack your locker. That might not be my decision. I think it will be. He looked at the door, then back at her. There are people in this hospital who are going to do the right thing. Park is one of them. Reyes is one of them. That resident, Anand. She put her career on the line in a lobby in front of a general she didn't know to tell the truth about what happened. That's not nothing. He paused. And there are people in my world who are going to want to talk to you. Don't be alarmed by that. It's going to be the good kind of conversation. She wasn't sure what to do with that. She filed it for later. Park came back in. Her expression had changed. Not alarm, but the sharpened focus of someone who has received new information and is rapidly updating. That was the ICU, she said. She looked at Emily first, then Webb. Your son is awake, she said to Webb. He's asking if the person who helped him is still here. Webb looked at Park. What did he say exactly? Park hesitated. He said, Is the woman who kept me from dying still in the building? Because I didn't get to say anything. She paused. He's 23. His exact words were a little more emphatic than that, but that's the substance. Webb looked at Emily. She thought about the young man in the blue t-shirt, the one who'd come in on that fourth gurney with blood on his shirt and not much time. She thought about the moment in the OR when the clamp had held and the pressure had stabilized and she'd known, not hoped, known, that they had enough, that the math was going to work. Yes, she said. I'll go. They walked out together, Webb and Emily, and in the hallway Donna was waiting. She was just standing there near the elevator, not pretending to be doing anything else, because Donna Reyes had been at Riverstone for 15 years, and she knew what moments looked like, and she wanted to see this one. Emily caught her eye as they passed. Donna nodded. Just once. The kind of nod that carries a full conversation in it. The elevator opened. Down the hall, in the administrative wing, in a small conference room that smelled like stale coffee and printer paper, Victor Hayes was sitting alone with his phone face down on the table and his hands flat on the surface in front of him, and for the first time in a very long career, he was beginning to understand what it felt like to wait for someone else to decide what happened next. The ICU on the 5th floor had a different quality than the trauma bay. Quieter, more deliberate. The sounds here were the slow, measured sounds of bodies in recovery rather than bodies in crisis. Monitors at steady intervals. The soft footfall of nurses doing rounds. The particular hush of a floor where people were still deciding which way things went. Webb stopped at the door to room 512 and looked through the narrow window. Emily stood slightly behind him. She could see past his shoulder. The young man was propped at a slight incline, oxygen line under his nose, an IV in each arm, a hospital gown that was already twisted because people who are young and restless are bad at staying still even when they should. His color was better than it had been. Not good yet, but better. The gray-white of the trauma bay had softened into something that was at least in the direction of alive. Webb put his hand flat on the door for a moment. It was a small gesture, private. Then he pushed it open. The young man turned his head. His eyes found Webb first. Father. Obviously, you could see it in the way he recalibrated. The complicated adolescent reflex of wanting comfort and not wanting to admit it. And then his eyes tracked to Emily, and he looked at her the way people sometimes look at faces from moments they only half remember. "Hey," he said. His voice was rough, the anesthesia still working its way out. "Hey," Emily said. "You're the one who—" He stopped, reconsidered. "They told me what happened. What you did." He looked at her hands for a second, which was an odd thing to look at, but she understood it. Hands were the part of it that made sense to look at when you were trying to make the thing real. "I don't—" He stopped again. "You don't have to say anything," Emily said. "I know, I just—" He exhaled. It was the careful exhale of someone managing pain they're not willing to complain about. "I was awake for part of it. I don't remember a lot, but I remember hands. And I remember someone saying, 'I've got it,' and feeling like that was, like whoever said it meant it." He looked at her. "Was that you?" She thought back to the bay, to the moment when the clamp had seated and the bleed had slowed and she'd said those words to nobody in particular, just to the room, just to make the information available. "Probably," she said. He nodded slowly. It helped, knowing someone had it. He looked at Webb. "You got here fast." 37 minutes, Webb said. "My driver is very pleased with himself." "You always say that about Rodriguez." "Rodriguez always earns it." They looked at each other, father and son, in the particular way of men who don't say most of the important things out loud but know where the important things are. Then the young man looked back at Emily. "I'm Daniel," he said. "Daniel Webb. I know you probably had my chart." "I didn't actually read your name," she said. "I read the mechanism of injury and the vitals, and then there wasn't time for much else." "So you saved my life without knowing who I was?" "Yes." He absorbed that. "My dad's a general." "I know." "Does that—" He seemed to be working toward something, working around the edges of a thought that was partly the anesthesia and partly something more considered. "Does that change anything? For you?" She thought about the question seriously rather than deflecting it. "No," she said. "You were the fourth gurney. You needed a clamp on a torn aorta. That's what I know how to do." Daniel looked at his father. "I like her," he said. "I know," Webb said. "So do I." There was a moment of quiet, the good kind, the kind that doesn't need filling. Then Daniel shifted and winced and tried not to show it, which was very 23-year-old of him, and the nurse on duty came in to check the monitors and gently but clearly indicated that 2 visitors were probably one too many for someone 6 hours out of vascular surgery. Webb touched Daniel's arm once, briefly, and told him he'd be back in an hour. Daniel said fine and immediately looked like he was going to be asleep before they left the room. In the hallway, Webb didn't speak for a moment. They walked to the end of the corridor where there was a small family waiting area. 2 chairs, a low table, a window with an uninspiring view of the hospital's service drive. "He's going to be fine," Emily said. "I know." Webb sat down in one of the chairs. He sat the way men sit when they've been moving through high-stress situations for hours, and the situation has finally resolved enough to allow the body to report in. A specific kind of settling. I knew it when Park's office called. It doesn't stop being a relief to see it. Emily sat in the other chair. "I want to tell you something," Webb said, "and I want you to hear it as information, not as... It's not a transaction. I'm not saying this because you saved Daniel. I'm saying it because it was already true, and today just made it visible." She waited. "When you were with the unit," he said, "the work you did was classified at a level that meant it wasn't going to follow you out in the obvious ways. Commendations are filed. The record exists. But the story doesn't travel the way it should. The people you helped, the soldiers, the outcomes, That's not on a plaque somewhere. It's just in the files and in the people who were there. He paused. That's the right way, in some respects. Discretion is part of how that work functions. But it also means that when you walk into a civilian hospital in Port Ashford, you walk in carrying a record that nobody can see. I wasn't looking for anyone to see it, Emily said. I know, that's exactly the problem. He leaned forward, forearms on his knees. What Hayes did to you today, the way you've been treated here for 14 months, that's partly Hayes being Hayes. It's partly an institution that doesn't ask the right questions when it hires. But it's also partly a gap in how we transition people out. People like you come back with more capability than most civilian environments know what to do with. And instead of putting that capability somewhere useful, we hand you a discharge document and a phone number for a veteran's hotline and wish you luck. Emily said nothing. She was looking at the window. I've been trying to fix that, Webb said, for the last 2 years. There's a program. I won't bore you with the bureaucratic name. It's a terrible name. But the substance of it is placing former combat medical specialists in training roles. Teaching. Working with trauma units, both military and civilian, on bridging the gap between field medicine and hospital medicine. There are techniques, things you use today, that most civilian trauma programs don't know exist, and there are field medics who could benefit from structured civilian clinical experience. He paused. It's a real program with a real budget and real positions. One of them has been harder to fill than the others because the person we need for it has a very specific profile. She looked at him. I'm not offering you a job today, he said. I want to be clear about that. Today is not the day for that conversation. Today is the day where a man almost lost his son and a woman was fired for saving him, and those things need to finish resolving before anyone talks about anything else. He held her gaze. But I want you to know the conversation is coming, and I want you to not disappear before it happens. Emily looked at him for a long moment. I'm not going anywhere, she said. I still have a half-packed locker downstairs. That got a real response from him. Not quite a laugh, but close. The particular loosening of a face that has been holding something tightly for several hours. They sat for a moment. In the room down the hall, Daniel Webb was probably already asleep. Can I ask you something? Emily said. Yes? 4 years ago, when you came through the forward station, you stopped at every cot. I always do. You stopped at mine. I wasn't a patient, I'd been on for 30-some hours and I was sitting on a cot filling out paperwork. You stopped, and you asked me if I needed anything. She paused. Nobody asked that. Not to the medical staff. You asked. Webb was quiet for a moment. I remember the station. I don't remember the specific. You don't have to. I always thought it was a small thing, but it wasn't a small thing. She shrugged, one shoulder. That's all. He looked at her. You were the one with the paperwork and the terrible coffee. She blinked. You do remember. I remember because I thought, this person is exhausted and she's still doing the paperwork, and that's either extraordinary discipline or she doesn't know how to stop. A pause. I still don't know which one it was. Both, Emily said. Usually both. He nodded, like that was the right answer. They went back downstairs. The lobby had settled into a later afternoon version of itself. The military vehicles were still in the drive, which had become a quiet source of fascination for the hospital staff, several of whom had found reasons to walk past the front windows. Webb's detail had positioned themselves with the professional patience of people who are good at waiting. Park was at the front desk, speaking to Donna. She looked up when the elevator opened. Emily, she said, do you have a minute? They went to a smaller conference room off the main hall, the kind of room that gets used for uncomfortable conversations, with a rectangular table and chairs that don't quite match, and a whiteboard with old marker that hadn't been fully erased. Park sat down. Emily sat across from her. Webb stayed near the door. I've spoken with the board chair, Park said, and with our legal team, and with HR. She laid her hands flat on the table. The termination is rescinded, officially as of 30 minutes ago. You're still employed here, at your current grade and rate, with no interruption to your record. Emily nodded. I'm also initiating a formal investigation into the concerns you raised regarding Dr. Hayes' clinical conduct. I'll need that log you mentioned. Everything you documented, with dates. I can have it to you within the hour. I'll also need a formal statement about today. The trauma bay, the sequence of events, the clinical decision-making. The incident report Donna filed is good, but yours will carry different weight. Understood. Park looked at her for a moment. There's going to be some noise, she said. In the building, people talk. Some of it's going to be supportive and some of it's going to be people who worked with Hayes for a long time and don't like having their assumptions revised. She paused. I want you to know that my door is open in a way that it perhaps should have been opened sooner. Emily took that in. One more thing, Park said. She seemed to be choosing her next words with care. I'd like to know, and you don't have to tell me, your background, your actual background. I looked at your HR file this afternoon, and there's a gap. And I have a theory about what's in it, and I think if I'm right, it changes how I should have been deploying you in this hospital from the beginning. Emily looked at Park, then at Webb briefly, then back at Park. I served in the Army, she said. 7 years. Combat surgical specialist, 3 deployments. Last rank was captain. Park absorbed this without visible surprise, which suggested the theory had been fairly well developed. The technique you used in the trauma bay today, Park said, the resuscitative thoracotomy on a patient in cardiac arrest, that's not… She paused. We train for that procedure here, but the way you performed it, the speed, the precision under those conditions, that's not standard nursing training. No, Emily said, it's not. Where did you learn it? Forward operating environment, 3 hours outside the wire, no attending surgeon available, a patient with a penetrating chest trauma who wasn't going to make it to the airbase. She paused. I learned it there, and then I learned it better, and then I taught 2 field medics how to do it because you don't want that knowledge to live in only one person. Park was quiet for a long moment. I owe you a significant apology, she said finally, not just for today, for the whole context. You didn't know, Emily said. I should have asked better questions. There was a difference between those 2 things, and they both knew it, so Emily didn't argue the point. She just said, okay, and meant it in the same way she'd meant it earlier. Acknowledgement received, not absolution granted, but a thing that could be built on. Webb's phone buzzed. He looked at it, then at the room. I need to take this. I'll be in the hall. He stepped out. Park and Emily were alone. What do you need? Park asked. It was a different question than the ones that had come before, less formal, less administrative. Emily thought about it. I need someone to actually look at the log, she said, not file it and review it in 6 weeks. Look at it. The cases go back almost a year. If some of them are what I think they are, there are patients whose outcomes should be audited. I'll look at it today, Park said, and I need the staff who gave statements today, Anand and Kowalski specifically, to know that what they did isn't going to come back on them professionally. They took a risk. I'll speak to them personally. And… She stopped. And? Emily looked at the whiteboard with its incompletely erased marker. Someone had written risk management on it and then tried to erase it and left a ghost. I'd like to finish my shift, she said, however much of it is left. I'd like to just go back to work. Park looked at her for a moment. Then she almost smiled. That I can arrange, she said. They walked out of the conference room and back into the main hall, and Webb was there, phone call finished, with an expression that was more animated than it had been. That was DOD, he said to Emily. He said it quietly, without theater. There are 2 people in Washington who want to talk to you at your earliest convenience. I told them I'd deliver the message and you'd be in touch. He paused. I also told them that today was probably not the day. Thank you, she said. He nodded. I'll be here for a few more hours. Daniel's not being left without family tonight, but I want to exchange information before I leave. Donna can get you my number, Emily said. She already has everything else. That got a real smile this time. The charge nurse with the incident report, he said. She's been running this floor for 15 years, Emily said. Whatever you need to know about this hospital, she already knows it. Good to know. Emily turned toward the nursing wing, then stopped. Sir. She turned back. Thank you. For coming yourself. You didn't have to do that. He's my son, Webb said. Simple as that. She nodded and walked back toward the nursing station. Donna was at the desk, charting with one eye and watching the hall with the other, which was how Donna always operated. She looked up when Emily came around the corner, and her expression went through several things. Relief, satisfaction, a particular kind of vindication that is the specific province of people who were right all along and didn't need to say so. Well, Donna said. Well, Emily said, you're still employed. Apparently. Hayes is in a conference room with HR and 2 lawyers, which I know because Marcus told me, and Marcus knows because the lawyers signed in at the front desk. Park's going to review the log. Donna's eyebrows went up slightly. You gave her the log? Not yet. I'm going to pull it together now. Emily sat down at the secondary station and pulled up the charting system. She said she'd look at it today. Good. Donna set down her pen. You want coffee? The machine in the break room is bad, but it's hot. I already had terrible coffee this morning. 1 cup never did the job, Donna said, and went to get it. Emily pulled up her documentation files. 11 months of careful, dated, specific notes, cases flagged, concerns raised, responses received or not received. It was a dry document, deliberately so. She'd written it without editorializing, without emotion, just the facts and the timestamps and the clinical details. Reading it back now, she was struck by how much it looked like exactly what it was, a record kept by someone who didn't know if anyone would ever look at it, but who needed to know that they'd done the work. She started organizing it into the format Park would need. 3 beds down, a post-op patient was asking for water. Emily got up, got the water, checked the chart, adjusted the pillow, answered the question about discharge timing with the approximate honesty the situation called for. A few more days, probably. Let's see how tomorrow looks. And went back to the desk. Donna came back with 2 cups of bad coffee. They worked in parallel for a while, the way they'd worked for 14 months, and the afternoon moved through its last hours with the ordinary, necessary pace of a hospital doing what hospitals do. The drama of the day didn't disappear. It was in the building the way weather is in the air, but the immediate urgency of it had resolved into something that would be processed later, in meetings and reports and decisions that would take weeks to fully play out. At 6:40, Emily sent Park the organized log. 43 documented incidents, 11 months, 3 categories, medication concerns, procedural flags, and patient outcome items requiring follow-up audit. Park's response came 11 minutes later. Received. I'm reading it now. Thank you. At 7:15, the day shift ended. Emily stood up from the desk, put on her jacket, picked up her bag, the half-packed bag from the locker, now repacked and back on her shoulder, and said goodnight to Donna. Tomorrow? Donna asked. Tomorrow, Emily said. She walked toward the elevator. The lobby was in its early evening configuration, quieter, softer lit, the particular atmosphere of a building shifting from daytime urgency to nighttime maintenance. A few of the staff she passed nodded at her. One of the residents, not Anand, a younger one she didn't know well, said her name and then seemed unsure what to say after it, and she just said goodnight and kept walking. At the main entrance, she pushed through the doors into the evening. Port Ashford in October was cool without being cold, the air carrying the particular salt and city combination of a coastal place settling into the dark. The military vehicles were still in the drive. She noted them without surprise. Webb would be upstairs with Daniel for a while yet. She stood on the sidewalk for a moment. Her phone buzzed. Unknown number, local area code. She looked at it, debated, answered. Emily Carter, she said. Ms. Carter, this is Gerald Marsh. I'm a reporter with the Port Ashford Courier. I'm trying to reach you in connection with an incident at Riverstone Medical Center today involving military personnel and... She ended the call. She stood there another moment. The evening moved around her. A car leaving the lot, someone arriving at the ER entrance, the ordinary continuous motion of a hospital running its second shift. In about an hour, the night crew would be in those halls, and the patients would be in their particular overnight version of waiting and healing and whatever came next. She started walking toward her car. Her phone buzzed again. This time, she looked at the number before answering. It was Webb's direct line, which Donna had apparently already provided because Donna was efficient in ways that bordered on supernatural. "Sir," she said. "Daniel's asleep," Webb said. "He asked me to tell you something before he went out." "What?" He said, "Tell her that was a good catch." A pause. "I believe he was attempting to be casual about it." Emily stopped walking. She looked at the evening sky over Port Ashford. Cloud cover, the particular orange-gray of a city at dusk, one visible star in the gap to the west. Something in her chest that had been held at a specific tension for a very long time shifted fractionally. "That was a good catch," she said. "Yes," Webb said. "It was." She put the phone in her pocket and kept walking. Behind her, on the 5th floor of Riverstone Medical Center, a night nurse was doing rounds. On the 3rd floor, Sylvia Park was reading 43 incident reports with a red pen in her hand and a look on her face that the morning was going to do something about. In a conference room that smelled like stale coffee, Victor Hayes was reading a letter from the hospital's legal team that began with the phrase "pursuant to the findings of the preliminary review" and did not improve from there. And Emily Carter walked to her car in the Port Ashford evening with the military coin in her jacket pocket, solid and specific against her palm, and thought about what Donna had said that morning. Some things you can see coming all day long and it doesn't matter because you can't stop them. You can only be ready when they land. She had been ready. That would have to be enough, for now. But she had a feeling, careful, not yet certain, but present, that being ready was about to mean something different than it had for the last 14 months. She got in the car. She sat for a moment with her hands on the wheel. Then she started the engine and pulled out of the lot, and the hospital grew smaller in the rearview mirror, and ahead of her the city of Port Ashford laid itself out in its ordinary evening geometry, unaware and uninterested in what had changed inside one building today, or in the particular quality of quiet that surrounds a person who has held a great deal together for a very long time and has just, barely, newly, begun to put it down. 3 days passed before the hospital addressed it publicly. Emily spent those 3 days working her shifts, which felt strange, and then felt normal, and then felt strange again in a different way. The way things feel when the context around them has changed, but the surface of them hasn't. The halls looked the same. The equipment was the same. The patients needed the same things, but the way people moved around her had changed, subtly, in the manner of people who have updated their understanding of something and are still working out what to do with the update. Some of them were warm. Preeta Anand stopped by the station on the second morning and said simply, "I'm glad you're still here," and Emily said, "Thank you for what you did in the lobby." And that was the whole conversation, which was the right length. Kowalski brought her coffee on the 3rd morning without saying anything about it, just set it down and walked away, which was very Kowalski and which she appreciated. Some of them were awkward. There were staff who'd worked closely with Hayes for years, who'd orbited his confidence and his certainty and built their professional habits around the assumption that he was the fixed point. And those people didn't know how to recalibrate. They weren't hostile. They were just unsettled in the specific way of people whose map has turned out to be wrong and who haven't printed a new one yet. A few kept their distance entirely. She didn't blame them. Institutions protect themselves through patterns, and she had broken a pattern, and that cost something even when it was the right thing. Hayes didn't appear. He was on administrative leave, which meant his car wasn't in his usual spot, and his voice wasn't on the overhead page, and his particular gravitational pull was absent from the trauma bay. The bay ran, she noticed, at approximately the same efficiency in his absence. The residents had learned from him, some good things, genuinely, and they applied those things without the interference of his ego, and the result was a unit that was somewhat quieter and somewhat less prone to the particular choreography of deference that Hayes had always required. She wrote her formal statement on the first evening, sitting at her kitchen table with the window open and the sounds of her neighborhood coming in, someone's television, a dog, traffic on the cross street. She wrote it the way she'd written every incident report in 11 months, factual, sequential, time-stamped, with no adjectives that couldn't be defended. She described what she'd observed, what she'd assessed, what she'd decided, and what she'd done. She described Hayes' delay without editorializing about its cause. She described his statement in the lobby about the thoracotomy without characterizing his intent. She described her own actions with the same neutrality she'd apply to anyone else's. She read it back twice. Then she sent it to Park and went to bed. She slept better than she expected. On the morning of the fourth day, Park called her into the office. Park had the look of someone who had been reading for 72 hours, which she more or less had. The log Emily had provided had apparently opened several doors that led to other doors, and behind those doors were things that the legal team and the board chair and the patient advocacy office were now looking at with varying degrees of urgency. Park's desk had acquired additional files since Emily had last seen it. Her coffee was cold in a way that suggested she'd poured it some time ago and forgotten about it. "Sit down," Park said. Emily sat. "I've been through the log, all of it." Park pressed her fingers together on the desk. "I've also pulled the charts on 12 of the cases you flagged. We're currently in the process of auditing 7 of them, including 3 where I have genuine concerns about patient outcome and whether different clinical decisions would have changed things." She paused. "I want to be transparent with you about what that means. It means this is no longer just about Hayes' conduct in the trauma bay last week. It is also about a pattern of clinical behavior over a significant period of time." Emily was very still. "I'm not going to tell you every detail of an active investigation," Park said, "but I want you to know it's real, and it's moving, and it has weight." "Okay," Emily said. "Hayes has been formally notified that his medical privileges are suspended pending the outcome of the investigation. That's separate from the administrative leave. Privilege suspension has to go through the Credentials Committee, and it did, and it was not a close vote." Emily absorbed this. "His attorney has already been in contact with the hospital's legal team," Park continued. "This is going to get louder before it gets quieter. I want you to be prepared for that." "I've been in louder situations," Emily said. Park looked at her for a moment. "Yes," she said. "I imagine you have." She picked up a folder and slid it across the desk. "Your personnel file. I had HR correct the records to reflect what you told me. The gap is annotated as military service with an appropriate note. Your file should reflect your actual background." She paused. "It should have from the beginning." Emily looked at the folder without opening it. "There's also this," Park said. She slid another sheet across. It was a formal letter, hospital letterhead, signed by Park and by the board chair. Emily read it. It was a statement of commendation, specific, factual, describing what she had done in the trauma bay and the outcome, and stating formally that her actions had been within protocol and that the hospital recognized her for them. She set the letter down. "Thank you," she said. "It's not sufficient," Park said. "I want to be honest about that. A letter doesn't fix 11 months of an environment that treated you as less than what you are. It doesn't audit the cases fast enough or give back the hours you spent documenting things that should have been caught by people above you." She paused. "But it's what I can do right now today, and I'm doing it." "It's something," Emily said. "It's something," Park agreed. Emily picked up the folder and the letter. She stood up. Then she said, "The 3 cases where you have genuine concerns about outcome." Park looked at her. "If there are families who need to be contacted," Emily said, "if there are conversations that need to happen with patients or next of kin, I'll help with that, if it's useful." She paused. "I know how to have those conversations." But Park was quiet for a moment. "I know you do," she said. "I'll keep that in mind." Emily walked out. The corridor had its mid-morning quality. Busy, but not frantic. The rhythm of a department that had found, over the past 3 days, what it felt like to breathe at a different pace. She went to the station, put the folder in her locker, and started her rounds. At 11:15, Webb called. "I have someone who wants to meet with you," he said. "In person. Can you do Thursday?" "This Thursday?" "If it works." "Where?" "Here," he said. "The base. I'll send a car." She thought about Thursday. She had a day shift that ended at 3. "After 4, she said. "After 4 works." She heard something in the background, a voice, younger, saying something she couldn't make out. Then Webb said, away from the phone, "She said after 4. And Daniel's voice said something that sounded like, "Tell her I said hi." "Daniel says hi," Webb said. "Tell him the incision is going to itch and he shouldn't scratch it." She heard Webb relay this. She heard Daniel say something emphatic in response. He says he knows, Webb said. He doesn't know, Emily said. But he'll find out. She hung up and went back to her rounds. The hospital moved through the rest of the week the way hospitals do. Emergencies and recoveries, and the steady, unglamorous work of keeping bodies functional and people informed and families from the worst versions of the news they were waiting for. Emily worked her shifts. She gave her statement to the investigation team on Wednesday morning, a 2-hour session with 2 attorneys and a clinical standards officer, where she answered every question with the same flat precision she'd put in the written version. The attorneys were thorough. She was thorough back. On Wednesday afternoon, Preeta Anand found her in the break room. "Can I ask you something?" Preeta said. "Sure." Preeta sat down across the table with a coffee she wasn't drinking. She was 27 and she was going to be excellent. Emily had seen enough people in enough high-pressure situations to have a functional read on that. But right now she had the look of someone sorting through a complicated set of feelings about a complicated set of events and not being sure which order to put them in. When Hayes said what he said in the lobby, Preeta said, about the team response, you didn't correct him. No. I almost didn't either. She looked at her coffee. I stood there for, it was maybe 30 seconds. 30 seconds of calculating. And in those 30 seconds, I was thinking about my residency and my evaluations, and whether Hayes still had enough pull to make things difficult. And she stopped. I almost didn't say anything. But you did, Emily said, because I was calculating and the calculation came out on the side of saying something. She looked up. I want to be clear, that's not the same as just doing the right thing. Emily looked at her. You know what the difference actually is between calculating the right thing and just doing the right thing? Preeta waited. Nothing, Emily said. The outcome is identical. The path you took to get there is your business. She paused. The fact that you were scared and said it anyway is what matters, not whether you felt righteous while you were doing it. Preeta absorbed this. You're going to be a good doctor, Emily said. You're going to make hard calls, and some of them are going to be wrong, and you're going to have to figure out how to keep moving after that. What you did in that lobby is more useful training for that than most of residency. That's a very strange thing to say. Probably, Emily said. But I've been in a few situations where the calculus mattered more than the feeling, and I'd rather have someone next to me who can run the numbers under pressure than someone who feels righteous and freezes. Preeta considered this for a long moment. Did you freeze? Ever? Out there? Emily thought about it honestly. Once, she said. Early, first deployment. There was a moment where the situation was bad enough and fast enough that my brain just stopped. For about 4 seconds. What happened? Someone next to me made a decision and started moving, and my brain caught up with the movement, and I went with it. She picked up her coffee. After that, I understood that sometimes the best thing is to not be the one who freezes, and sometimes it's to be the one who moves so the person next to you can catch up. It's not always the same job. Preeta was quiet for a moment, then, what happened to the patient in the first deployment? Emily looked at her. He made it. Preeta nodded slowly, like she was filing that somewhere important. Thursday came. The car Webb sent was not the black military vehicle she'd half expected. It was an ordinary sedan driven by a staff sergeant named Torres, who was professional and quiet and had good taste in radio stations. They drove 40 minutes out of Port Ashford on a route that eventually turned onto base access roads, and Emily watched the landscape shift from city to perimeter and felt the old ambient awareness of military space come back, the way you feel a familiar gravity after a long time away. Webb met her at the administration building. He looked more like a general here than he had at the hospital. Same person, different context, and context does something to how a person inhabits their own authority. He also looked, she noted, like someone who had slept in the last 4 days, which improved his general presentation. Daniel was discharged yesterday, he said, by way of greeting. Already? He negotiated aggressively, Webb said. The discharge team was outnumbered. She almost smiled. He needs to take it easy. I've been told to tell him that 7 times a day. He's staying at my place for the next 2 weeks, which means I'll be able to do that in person. He held the door open. Come in. The meeting was in a conference room that was considerably nicer than the one at Riverstone. Actual chairs that matched, actual water in a real pitcher, a window that looked over a courtyard where someone had managed to keep grass alive through October. There were two people already in the room. One was a woman in her late 40s in civilian clothes, introduced as Dr. Rachel Voss, who turned out to be the director of the trauma integration program Webb had mentioned. The other was a man in his 50s in Army uniform, Colonel Dennis Rafferty, who ran the Field Medical Training Division. Emily sat down. Webb sat across from her. Voss spoke first. "We've reviewed your service record," she said, "both the classified summary and the commendation file. We've also spoken with 3 people you served with their permission." She paused. "We're not going to spend a lot of time today on your past. We're more interested in what you want to do next." Emily looked at her. "What's the position?" Voss outlined it. The program was real, as Webb had said. It placed former combat medical specialists in a dual role, part civilian trauma consultation, part military field medicine training. The job involved working with civilian trauma centers to integrate field medicine protocols, the kind of techniques that saved Daniel Webb's life, techniques that most hospital trauma programs didn't teach and didn't know to ask about. It also involved working with forward medical training units to develop curriculum that bridged the gap the other direction. The base of operations was flexible, partly here, partly in the field, partly traveling to partner hospitals. "The base salary is competitive," Rafferty said. "Housing allowance available if needed. Schedule is structured, but there's flexibility built in, because some of the work is response-based." "What's the timeline?" Emily asked. "We'd like a start date in January," Voss said. "That gives you time to transition properly from Riverstone if you choose to accept, and gives us time to finalize the partner hospital agreements we're working on." "One of the partner hospitals," Webb said, "is Riverstone." Emily looked at him. "Park agreed last week," he said. "The program places a training liaison in the hospital's trauma department. That liaison would also serve as a resource for the kind of clinical concerns you documented in the log, an independent set of eyes with enough standing to actually flag things in a way that gets addressed." She was quiet for a moment. "You'd be going back," Webb said, "but differently." "I know the building," she said. "You know all the ways it doesn't work," he said, "which is exactly what the position requires." She looked at the table for a moment, then at Voss, then at Rafferty, then at Webb. "I have some questions," she said. "Good," Voss said. They talked for an hour and 40 minutes. Emily's questions were specific and practical, about reporting structure, about the scope of the clinical authority attached to the role, about what happened when partner institutions pushed back, about funding stability over a multi-year horizon. Voss answered thoroughly. Rafferty answered the parts that were his domain. Webb answered the parts that were nobody else's domain. At the end, Voss said, "We'd like a decision by the end of the month. Take the time you need." Emily nodded. They walked her back to the car. Torres was waiting, patient and radio-equipped. Webb stayed at the entrance while the others said goodbye. "Well," he said when it was just the two of them. She looked at him. "You already know what I'm going to decide." "I have a theory," he said, "but I don't want to be presumptuous." "Yes," she said. "I'm going to say yes." He nodded once. "January?" he said. "January," she said. She got in the car. On the drive back, with Port Ashford growing back into the windshield and Torres's radio playing something low and instrumental, she thought about the shape of what was coming. She'd spent 7 years learning to do things that most people didn't know needed doing, in places most people didn't think about, for reasons that never made it onto any record that civilians would read. She'd come back from that with more capability than she knew what to do with, and an instinct toward invisibility that had served her and cost her in approximately equal measure. 14 months of being overlooked, of flagging things and watching them not get addressed, of working around a man who mistook volume for competence and had been allowed to continue that mistake long enough that it had become the environment's default assumption. And then one afternoon in October, the 4th gurney came in, and the math was simple enough that there was no space left for any of the complicated calculations. She thought about what she'd told Preeta. Sometimes you're the one who moves so the person next to you can catch up. She'd spent a long time not moving, not because she was afraid, She'd worked out most of her fear in places where fear was a luxury, but because the environment had suggested continuously and in small ways that moving was not her role, that her role was to be present and capable and quiet and to fix things without being seen fixing them. That wasn't a role anymore. She looked out the window at Port Ashford coming back into view, the water in the distance, the industrial waterfront, the residential blocks stepping up from the harbor, the hospital in the middle distance with its particular geometry against the early evening sky. She thought about the families of the 7 cases Park was auditing. She thought about what some of those conversations were going to look like, and about what it meant to sit across from someone and tell them something they didn't want to hear in a way that gave them room to hold it. She was good at that. She'd always been good at that, and she'd never been put in a position to use it here, because being good at the hard human parts of medicine didn't register as a skill when the person assessing you had decided what your skill set was. That was changing. Torres pulled into the hospital lot. "Here, ma'am." "Here," she said. "Thank you." She got out. She stood for a moment in the lot with the evening coming on around her. Then she walked back inside. Donna was finishing her shift. She was at the station putting on her coat when Emily came around the corner, and she looked up with the particular expression she wore when she was pretending she hadn't been waiting. "Good meeting?" Donna said. "How did you know I had a meeting?" "Webb called the desk to leave the car information. Marcus told me." "Marcus tells everyone everything." "Marcus is an information utility," Donna said. "Don't knock it." She finished buttoning her coat. "Well?" "I took a position," Emily said. "Starts in January." Donna looked at her. "At the base?" "And here. It's a liaison role. Both." Donna absorbed this. "So you're staying." "I'm staying." Donna's expression did something that she probably would have described as nothing and was actually everything. "Good," she said. "Someone has to." She picked up her bag and walked toward the elevator, and in the elevator doorway she turned around. "For what it's worth," Donna said, "I knew the first week that you were something the building didn't know what to do with." "What gave it away?" "The way you read the board before anyone asked you to," Donna said. "People who are just doing a job look at the board when they need to. People who actually see the board look at it because they can't help it." The elevator opened. "Good night, Emily." "Good night, Donna." The elevator closed. Emily stood at the station for a moment. The evening shift was in full motion around her. The handoff happening, the night nurses getting their assignments, the residents cycling through for evening rounds. The ordinary machinery of a place that didn't stop. 3 weeks later, on a Tuesday morning, the Port Ashford Courier ran a story. She hadn't spoken to any reporters. Park hadn't either. The story had been assembled from public records, from the Credential Committee's public filing, from a statement issued by the hospital board. It named Hayes specifically, listed the suspension of his privileges, and described the ongoing investigation into his clinical conduct over a 9-year period. It mentioned in the 6th paragraph that the incident prompting the investigation had begun when a nurse had performed an emergency thoracotomy that saved a patient's life while the attending physician on duty failed to respond. It did not name her. She read it on her phone in the break room and drank her coffee and went back to work. Hayes's medical license came under formal review by the state medical board 6 days after that, triggered by the hospital's self-report as required under state law. The process, she understood, would take months. It would be careful and procedural and documented with the same painstaking specificity she'd applied to her log, because that was how accountability worked in institutions that had to keep working after the accounting was done. She didn't know what the outcome would be. She had a theory based on what Park had found in those 7 charts. But she'd learned a long time ago that outcome wasn't her department. Her department was the work in front of her, the next patient, the next problem, the next gap between what was happening and what should happen, and the question of whether she could get there fast enough to make the difference. On her last day before the January start date, she worked her full shift at Riverstone. She did rounds, she managed medications, she caught a dosage discrepancy on a post-surgical patient in room 9 and flagged it to the attending, who thanked her, which was different from how that conversation had gone 14 months ago. At the end of the shift, she went to the locker room and cleaned out the last of her things. The locker was the same locker she'd packed and then unpacked 6 weeks earlier in the same room where Donna had found her and told her there were military vehicles in the lot. She stood there for a moment with the empty locker in front of her. Then she closed it and walked out. In the hall, 4 of the day shift nurses were there. Not staged, they weren't lined up, they didn't have anything in their hands. They were just there. In the way that people are when they've decided collectively to be somewhere without quite working out the details. Kowalski was leaning against the wall. Prita was standing with her arms crossed in the way she stood when she was being deliberately casual about something. Marcus had apparently walked all the way from the front desk for reasons he would not have been able to fully articulate. Emily looked at them. Nobody said anything ceremonious, nobody gave a speech. Donna, who had appeared at the end of the hallway, made no move toward fanfare of any kind. "January 12th, Emily said. "I'll be here at 9. "We know," Donna said. Emily walked to the elevator. She pressed the button and waited, and behind her the hallway had the quality of a space that holds something without needing to name it. Not celebration, exactly. Something quieter and more durable than that. The particular atmosphere of a moment that will be carried forward by everyone who was in it, not because it was dramatic, but because they knew what it meant. The elevator opened. She stepped in. The doors closed. She rode down through the building, past the 5th floor where Daniel Webb had opened his eyes and asked if the person who'd kept him from dying was still around, past the 3rd floor where Sylvia Park had read 43 incident reports with a red pen, past the 2nd floor where Victor Hayes had once moved through these halls as though they'd been built for him specifically, past all of that and down. The lobby, the front doors, the Port Ashford evening, cool and salt-aired and uninterested in the particular weight of what one person was carrying out of one building. She pushed through the doors. She stood on the sidewalk. Somewhere behind her, a hospital kept running. Somewhere ahead of her, a position was waiting that was the right size and shape for the particular person she'd become. Not in spite of what she'd been through, but partly because of it. She'd spent a long time being overlooked by people who didn't know what they were looking at. She was done being invisible. Not loud, not performing, not asking anyone to see her. Just done stepping back. She walked to her car in the dark, and the city of Port Ashford spread out around her, ordinary and different, full of people doing the work of their own lives. And she was one of them, which was all she'd ever wanted, and something more than that now. Something that had always been there, finally let out into the open. She drove home.